So hi, we are here today at Bose Vision in Exton, Pennsylvania. I'm here talking with two people that know everything that there is to know about vision therapy, and they're going to tell us a little bit more. So first, why don't you guys introduce yourselves?
My name is Dr. Mark Bose. My wife Suzanne and I founded this practice in 1989, and we've been here providing primary care as well as specialty care in the area of functional vision and vision therapy for all of those years.
I am Dr. Catherine Bose. I have joined the practice a year ago. So I have joined both my parents and my sister, Dr. Marie Gwynn, and the four of us here, we all specialize in pediatrics and treating learning-related vision disorders.
So you kind of grew up in this, huh?
Yes. That's exactly right. That's exactly right.
And this is where my son came last year when we started our whole vision therapy journey. So can you tell us first, what are some things that are really triggers or things that you're looking for when you're going to recommend vision therapy?
Well, there are a host of signs and symptoms that something could be awry. Oftentimes it's just a lack of academic progress. Other times it's obvious things like blur, double vision, headaches with reading, things like that.
Falling behind in school and teachers noticing that the child is using his or her finger to follow along reading, is skipping lines while reading, is reversing letters.
Trouble copying from the board.
Correct.
All things that my son had, every single one of them.
Yeah, so there's a host of learning-related vision disorders, primarily put into two boxes. One is the visual perceptual box, which deals more with the software of the visual system, and then the other is the visual efficiency skills that are more dealing with the hardware of the visual system, the eyes, the focusing muscles, and that primarily is put into three categories: focusing problems, problems using their two eyes together as a team, or ocular motor, what lay people call tracking issues. Those visual efficiency problems can really interfere with academic achievement, with sports accomplishment, and many different things. So the single most common problem in that group in children is convergence insufficiency, which is present in 5% of children, school-age children. And the main symptoms there, you'll notice they'll complain about their eyes hurting. They will avoid near work at all costs, oftentimes misdiagnosed as ADHD or ADD or ADHD. They also complain occasionally about double vision. They'll complain about losing their place when reading, having to reread the same line, feeling as though they're a slow reader, and they'll get to the end of a paragraph and not have a clue what they just read.
Right? Yeah.
Comprehension.
No idea.
So that's normally what you see in visual efficiency problems. The software problems come out when the child does a lot of letter reversals. They maybe are just sloppy with their vision to where they can't discriminate carefully the world around them, or they don't have the world organized in their visual spatial skills to knowing left from right, up from down, and so on. And those soft perceptual skills can really interfere with a child's academic achievement. And we're not even talking about the whole area of neurovision rehab with a post-TBI patient who has had dramatic damage to their visual system, which oftentimes goes totally unnoticed.
But that's another thing we specialize in here, along with the learning-related vision disorders.
Or those more serious situations that create vision problems, such as autism or on the spectrum, and cerebral palsy, all kinds of developmental issues in children that interfere with vision, that vision therapy can help. It may not be the only problem, and probably isn't, but if it is one of the obstacles that you can remove, then that's worth doing. And so you gotta,
So you're saying that it could be kiddos that are quote-unquote neurotypical, as well as kids that have other diagnoses or other
Yes.
underlying issues.
Absolutely.
Vision can be contributing
right,
to both of
no
those.
one
Absolutely.
no one taught anybody how to move their eyes when they read,
Right,
right?
right,
So we have an instrument here called a visograph, which actually you wear goggles and it measures how efficient their reading eye movements
right.
are.
And how,
And you can get an 8th grader
yeah,
who has 3rd grade efficiency of reading eye movements. They never knew it, except that they constantly were being told, why aren't you getting your homework done in time? Why are you so lazy?
right,
You know,
right.
and it's
Why
the,
are you paying
slow.
attention in
Yeah.
class?
and it really was
uh-huh.
not this kid's fault.
Right.
He didn't develop, as most kids do, normal, efficient eye movements. And once you discover that that's the problem,
Right.
you address that with therapy, and you can see remarkable changes in a child.
So for those of us who are homeschoolers and we're really teaching our kids how to read, and we're watching them, if they're losing their spot on the lines, that's a sign of it. And
Using their finger.
Yes.
Rereading the same line, not enjoying reading, not remembering what they have read. Avoiding reading, moving their head more so than just their eyes, is a big thing. When they, when they can't just move their eyes to go across the line when reading and they're moving their whole head.
Did you have
That's
something to add about that?
I did. Well, that was going to bring me back to, so I've been talking a little bit about primitive reflexes,
Yeah.
and to do that you have to be able, one of them is that your eyes and your head and your neck can move apart from each other, or
Correct.
disassociate, right?
Right.
So is that something that needs to be fully intact before they would come to vision therapy? Or is that something you would address?
We would address it. And both of our vision therapists, Chrissy more than perhaps the other, are attuned to the primitive reflex development. And oftentimes if they're noticing a child is stuck, if you will,
Right.
may try some work on primitive reflexes, and oftentimes and most times progress can be made. There's a lot of work that we need to do to better understand primitive reflexes, me
Right.
more than anyone. It's a newer field of study that people are realizing affects vision greatly,
Right.
especially in the brain injury patients
Yeah.
who have,
Right.
it's one thing to
Right.
develop and normal reflexes and they develop. It's another thing to have what were normal now abnormal.
Yeah.
And so that's a lot
Right.
of work that needs to be done in that area. But it's true that if a child simply cannot follow a line of words because they didn't develop that ability,
Right.
no one's testing for that in school.
Yeah.
Except they're getting Fs on their reading assignments. And the homeschoolers, if the parents are working with the kids
Right.
and they're noticing avoidance, complaints of, just their eyes don't feel comfortable,
Right.
especially if they say things are occasionally double,
Yeah.
that's a real red flag.
My son who said words were moving on the page.
That's another one, yeah.
How do you
Yeah.
read a word when the
Um,
letters are moving? That's
If
right.
homeschool parents want one tool to use to explore whether their child has a visual efficiency problem online, if they were to Google Convergence Insufficiency Symptom Survey,
Okay.
the CISS.
Okay.
It's online, it's a 15-question survey that is on what's called a Likert
Right.
scale.
Okay.
So, if it's never, sometimes,
Right.
infrequently, most of the time, all the time.
Right,
And
yeah.
there's 15 questions. Do your eyes hurt when you read? Do you see double when you read?
Yeah.
Do you get headaches when you read?
Right.
So if a parent
It's a
wanted
perfect
to,
screening.
it's a nice screening.
Okay.
Yes.
Now, it does not get at the perceptual issues.
Right.
But
That's
for the hardware, those
Right.
visual efficiency, a very good tool to use.
Okay. And so what would you say, what is the first step? So after they take this and they think, okay, this might be something that my child has, what would they need to do next?
Well, Depending upon the history.
Mm-hmm.
And, you know, you would take a serious developmental and educational history and see if you can identify the main areas of concern. So a functional vision doc like us
Okay.
would be able to do a screening and then determine if they need a visual efficiency evaluation.
Okay.
If most of the problems sound like they're more software issues,
Right.
visual spatial, visual
Right.
integration, visual discrimination, these, then we would wanna do a visual perceptual evaluation.
So what they should go, like if, so since this is from homeschoolers all across
Yeah.
the nation, right? So they
Right.
should Google functional vision experts
Correct.
to come so that they can send their kid there?
Right, here's a couple things.
Okay.
We're all members of the College of Optometrists and Vision Development, COVD.
Okay.
Okay?
Okay.
COVD.org
Okay.
has a doctor locator.
Beautiful. Okay.
And so you
Perfect.
can put in your
Zip code.
zip code and it'll give you
Okay.
all the docs who deal with this area.
Okay.
It's a tragedy when a kid who parents tell us they've been getting eye exams for 6 years and the
Yeah,
doctor
I
tells
know.
them
Right.
their eyes are healthy and their vision's
Right.
great, they're 20/20.
Yep.
They haven't even tested their
Tested any of
vision.
that. We ended up with that
So,
with the
so
proof at the
you
beginning.
wanna go to
Mhm.
some doctor who does functional vision testing.
Okay.
And that, COVD is a site that would be excellent for them.
So
Beautiful.
annual eye exams are important. That's always the first step to make sure the
Right.
eyes are healthy and we are getting clear eyesight 20/20, you know.
Okay, yeah.
But what we as functional vision docs go into is much more than that. As Dr. Mark was saying, all of the visual efficiency and visual perceptuals, and that all, you know, that's diving more into the visual system, which is more than just 20/20 eyesight.
Yeah.
Perfect. All right. Thank you guys
There,
so much.
I'll mention one more thing.
Okay. Absolutely. Please do.
There's an organization called PAVE, which stands
Okay.
for Parents Active for Vision Education.
Okay.
And I believe it's pavevision.org.
Okay.
So this is a group of parents who have known that something's not right
Right.
with their child, has taken them for multiple eye
Right.
exams all through their school age, and then in
Yeah.
5th grade or 7th grade, they finally
They
get a
figure out what it
developmental
is.
vision
Mhm.
exam,
Mhm.
and this group of patients get very, or
Parents,
parents get
yeah.
very
Mhm.
upset.
Yeah,
And
I
they
mean-
learn about PAVE and they join a chapter
Ah.
whose main goal
Is
is
to
to
get the word out.
get the word out.
Okay.
They have a brochure called The Hidden Disability.
Okay.
I think it's online. The Hidden Disability really details why they're doing what they're doing.
Yeah.
Because, you know, at least 1 in 4 kids has a
Has
vision
something.
problem
Mhm.
that interferes with
Their learning.
their learning, yet, you know, it
It's
often
going
goes unnoticed. you know?
undiagnosed, yeah.
So PAVE is a good
Okay.
one for
So
that.
Pave is another really good
Yep.
reference. Okay. Beautiful. Thank you so much for
You're
your
welcome.
time.
You're welcome.